Hello, my name is Jessica Peters. I'm a senior biology health science major here at Bloomsbury University, and today I will be talking about malaria. The reason I chose this topic is because it is a big health issue around the world today. Some countries are affected larger than others, which we'll talk about. Being a health science major, I found a large interest in learning more about the disease. Before going into detail, I first wanted to talk more about malaria. Malaria is an infectious blood disease that is caused by a Plasmodium parasite. A parasite is an organism that lives off of another organism. It's generally not good. It is transmitted by the bite of an infected female mosquito, and the parasite is present inside the saliva. So when you get bit by a mosquito, the parasite gets brought into your bloodstream. And this causes fever, chills, and flu-like illnesses and can also lead to death. About 3.2 billion people are at risk of malaria. And also the CDC, or the Center for Disease Control, estimated 214 million cases of malaria occurred worldwide, and out of that, 438,000 people died. So it is a large problem in the world today. In the next few slides, I want to bring about the importance of the cause of malaria, or the cause and the spread of malaria. So we know that malaria was caused by a parasite, but how exactly has it spread across the world? And it's typically because it's intertwined with global issues, political, economic, and cultural parts of globalization. There are a few key things that I want to talk about that help the spread of the disease. And it's very important to understand because infectious diseases are the leading killers of human beings. One of the major contributions to the spread of infectious disease is with ethnic conflicts, widespread violence, and wars. When you have wars going on and violence, and you have refugees and collapse of public services, people can't get treated for diseases that they could normally get treated for. You also have food shortages and unsanitary conditions. Those would lower your immunity, and you wouldn't be getting the right nutrition and the right sanitary to prevent diseases from coming. When you also have wars, you have movements of troops, and troops going from different parts of the country. And if they get infected, they spread it to other parts of other countries. So all of these contribute to spreading infectious diseases such as malaria. Another major contribution to the spread of infectious diseases is when the parasite has a potent breeding environment to replicate and continue on to new hosts. So when you have a good environment for a parasite, it's more easily for them to spread and to survive. Environmental degradation and deforestation helps with making this environment better. Global warming helps rise temperatures, and the rise in temperatures is better for parasites, along with flooding, natural disasters, and building dams. These all create a wet environment for parasites to survive, and they thrive in that more. Population growth also helps increase transmission of these parasites between hosts. So overcrowding, mass migrations, global transportation, all of these help spread the parasite to different countries. So in all, when you have wars going on and unsanitary conditions that give rise to the parasites, and you have environmental degradation, global warming, flooding, that help these parasites to replicate and to survive and grow, and then you also have increase in transmission with population growth, all of these factors help put together the large spread of infectious diseases. And it also helps explain how malaria got to be so large and spread around the entire world. Another contribution to the spread of disease over time is the overuse and misuse of treatment. And this causes what's called a pathogenic natural selection, which is the process that promotes more virulent and resistant disease strains. So these diseases become resistant to the previous treatments because they evolved over time. And so now treatments that worked before won't work anymore. And so this is caused by an increased use of antibiotics in agricultural products. Another thing is that before there was something called DDT spraying, which was an agricultural insecticide. And so they found out that this was a danger to human health and environment, and it was highly organized and it cost a lot of money. So they don't do it anymore. But this might have also caused antimicrobial resistance. Other factors that contribute to the spread of disease would be global trade, various transmissions, and the use of biowar or bioterrorism. So they would use diseases as a biowarfare. Trade liberalization contributes to the spread of infectious diseases by reducing the role of government in providing healthcare and other services. So that's how trade is affected. Today, there's rapid expansion of trade with China, and that exposes the world of diseases. And global trade in agriculture also increases the risk of developing infectious diseases. As previously discussed, parasites need a potent breeding environment to survive. So they're mostly found in some parts of the globe that have the environment that they need. So sub-Saharan Africa, for one, has that environment where 88% of malaria cases and 90% of malaria deaths are found in sub-Saharan Africa. A child dies every minute from malaria in these countries, and that's why it's very important to understand so that we can help these countries in need with decreasing the mortality of malaria. So Africa is also largely affected in areas that are typically poor because there's a malnutrition, inadequate medical care, and unsanitary conditions. And these are where malaria is at high risk. So with understanding all the problems of malaria and how it affects half of the world's population, a large set of it being from sub-Saharan Africa where a child dies every minute, it is important to try to find a way to prevent malaria from occurring in these countries. So the WHO, or the World Health Organization, recommends protection for all people at risk of malaria with effective malaria vector control. So this is saying that ways to prevent mosquitoes from biting these people. So that would be the indoor residual spraying, which will spray houses, and it's like insect spray. It'll get rid of the mosquitoes, along with the insecticide-treated mosquito nets. Those will prevent mosquitoes from biting you as you sleep. And so they have these nets around beddings and other places as well. The LLINs are the long-lasting insecticidal nets, and those are preferred form of mosquito nets for public health programs. They're typically inexpensive and easy to distribute to countries in need, but most countries like sub-Saharan Africa can't even afford the $3 nets. So later on we'll discuss world organizations that help donate money to providing these nets to families in need. Indoor residual spraying with insecticides is a powerful way to rapidly reduce malaria transmission, and it's effective for 3 to 6 months. But the problem is that it takes multiple spray rounds, and it can be more cost effective than the nets. So sometimes it's not always the best option for some countries. People traveling into areas of high-risk malaria are given chemoprophylaxis, and this helps suppress the blood stage of malaria infections to prevent them from getting the disease. Also, pregnant women are at higher risk of malaria in these areas because they have a lower immunity, and so they're given special medication to prevent them from getting the disease. If the mother gets malaria, her babies are at risk of having a low birth weight and brain damage and cognitive impairment. So it's very important for these women to get medication. So malaria is preventable and it's curable, but still thousands of people are affected and die each year. And so we want to look at the current problems of malaria prevention and why, even though we have the cure and the treatment, why do we still have malaria around the world? And it's mostly because of things that we previously discussed. So sub-Saharan Africa is a poor country and they have unsanitary conditions and little money for the treatment and protective clothing that they would need to prevent malaria from occurring. Also, countries that experience natural disasters are at high risk of this disease because of flooding that occurs, and it helps increase that potent environment, or because they lose those facilities and the money that they had, and so now they can't get the treatment that they need. So in areas of high transmission, children are very susceptible to infection and illness as well because they have that lower immunity, and so they also get the illness a lot quicker than adults would. So all of these factors are why we still have malaria spread in the world today. And so now we want to look at ways that we can help these countries, these poor countries that still can't get the treatment and everything that they need to help stop the disease. So now that we stated the problems of malaria and how they affect certain parts of the globe, we want to figure out what is the solution. How are we going to help stop the spread of malaria? Well, so the global community recognized that controlling the spread can only be accomplished through the cooperation among individuals, non-governmental organizations, governments, and international organizations. So already many organizations are there to help and donate to prevent the spread. HUE, the CDC, the United Nations Children Fund, or UNICEF, they donate bed nets to children. As seen in the picture, those are donated nets to children in school to help them prevent getting the disease. Malaria No More Against Malaria Foundation, Nothing But Nets, and the United Nations Foundation. All of these I found on Google as sites that you can donate to help them prevent the spread to children in need, especially in children in sub-Saharan Africa. And not even just children, but other people as well. And there's so many more foundations to help people in need in countries that have high risk of malaria. The World Health Organization is a large organization that has been helping with malaria for a long time, and so they recommended a seasonal malaria chemo prevention, and this would help children under 5 years of age in Africa with not getting malaria. So they'd administer these monthly courses of medication to help these children. And also the WHO Global Technical Strategy for Malaria 2016-2030 is a strategy that provides a technical framework for all malaria endemic countries. And so it has a plan of what they're going to do and how it's going to be effective up until 2030. And then they also have a global malaria program that coordinates WHO's global's efforts to control and eliminate malaria as well. So they have all of these programs set forth to help malaria in the long run. Zambia is one of the countries in Africa that has a high risk of malaria. And so many foundations and organizations were put forth to help the people in Zambia from getting malaria. One is Bill and Melinda Gates Foundation. They donated $35 million to Zambia in order for them to achieve their goal in getting bed nets to 80% of its population. The picture in the corner shows Bill and Melinda with children in Zambia and how they helped these children in the prevention of getting this disease. Also, international organizations and governments They donated $85 million to supply the most effective malaria drugs to every public clinic and to pay for spraying programs across Zambia. So with all these contributions to that country alone, death rates declined by 60%, which is truly amazing. So we're already making huge contributions to helping the prevention of malaria. Malaria rates are starting to decrease. The WHO stated between 2000 and 2015, malaria incident among population at risk fell by 37% globally, and malaria death rates among populations at risk fell by 60% globally among all age groups and by 65% among children under 5. So all these donations and contributions are already starting to decrease in malaria found globally. So it's extremely important for people to donate and to help for this cause in getting rid of malaria across the world. So to wrap up everything we discussed, malaria is a current global disease that affects half the population, with most deaths occurring in young children every minute. So the spread of malaria is caused by underlying global issues, and this is what we talked about was from the wars, the deforestation, the population growth, the overuse of and misuse of antibiotics, and other factors including trade and all that. So those help increase the numbers of parasites along with increasing the spread to other parts of the world. And so although there's medications and cures to treat diseases, a lot of times this is seen in countries that are poor and can't afford the treatments and the things they need to prevent the disease. Also with countries that had global disasters, natural disasters that cause flooding and then cause them to be poor and not be able to get treatments. So those are also affected. And so many countries, including the US, have developed a number of organizations and strategies to help provide treatment and the nets to countries of high-risk malaria, such as sub-Saharan Africa. And so since 2000, malaria incidents have been declining. But it's very important that we keep donating and we keep putting in our contribution to this cause, because without us, it would not be declining. Thank you so much for listening to my discussion on malaria, and I do hope that you learned something new, and you learned that it is important for us to come together as a community and help countries in need. Thank you. I hope you have a very nice day.